Welcome to another episode of the Merck Manual's Medical Myths podcast. On this show, we set the record straight on today's most talked about medical topics and questions. Today, we're taking a closer look at sleeping disorders, specifically the common ones that most of us are familiar with but may be misinformed about: insomnia and sleep apnea. I'm your host, Joe McIntyre, and I'm joined by Dr. Richard Schwab. Dr. Schwab is a professor at the University of Pennsylvania Perelman School of Medicine in Philadelphia, where he is the chief of the Division of Sleep Medicine. If that name sounds familiar, Dr. Schwab did a two-part series on sleep and dream myths last season. If you haven't listened to it, please be sure to check it out. Dr. Schwab, thanks for joining us on the podcast.
Thanks, Joe. Glad to be back.
Well, we're glad to have you. So let's start off with the topic of insomnia. Can you tell our listeners what exactly insomnia is and how it is different from occasional sleeplessness?
So insomnia is a perception of inadequate sleep. And all of us have insomnia some of the time, right? You don't sleep well one night and the next night you sleep better and you wake up fine. Typically what happens in somebody who has chronic insomnia or prolonged insomnia, it's multiple nights where you have trouble sleeping.
Does having insomnia mean not getting enough sleep, or does it mean not getting any sleep? Is there a scale there? How does that work?
Yeah, it's hard because you're not measuring sleep in patients at home. At least we don't do that on a clinical basis. You could do it on a research basis. And again, it's this perception that you're not getting enough sleep. You may actually had a lot of sleep, but you perceive that you don't. And so we don't really know the answer to that question, but you're getting some sleep. It's not as if you're getting no sleep. You get some sleep, but you just don't get enough sleep, and you wake up and you just don't feel refreshed. You don't feel like you're yourself. You feel like you didn't get a good night's sleep. But it's more of this perception, so it's not so quantifiable.
Does insomnia affect people in different ways? Meaning, if someone gets, let's say, for example, 5 hours of sleep, that may constitute insomnia, versus if someone gets 4 hours of sleep, that may be okay. That may be enough sleep for them. How does that work?
Yeah, it really depends on how much sleep you need. And everybody's a little different. People need, in general, 7.5 to 8.5 hours of sleep. But it's really hard to figure that out. The only way you can sort of determine how much sleep you get is when you go on a vacation for 2 weeks. And the first week, you just kind of recover from all the sleep deprivation, because we are all sleep deprived. That's why we all drink coffee. So we're all sleep deprived. But if you take a week off and then you don't drink alcohol and you don't exercise differently, you might be able to figure out what the normal amount of sleep you require. But most people don't know that. Most people get more sleep on the weekends because we're overworked during the week. But in general, 7.5 to 8.5 hours. But there are people on both ends of that. So there are people who can get by with 5 hours of sleep. Other people who get by with 10 or 11 hours, who need 10 or 11 hours of sleep. But the insomnia piece of this is, well, if I normally get 7.5 hours of sleep, and now for whatever reason I'm getting 6 hours of sleep, or at least that's what I'm perceiving, then I'll feel like I have insomnia.
Now, let's dig into some of the myths surrounding insomnia. Is it true that a person can really live on no sleep at all?
No, everybody needs to sleep. And pretty much every mammal that we know of needs to sleep. How much sleep? A little more debatable, but everyone needs to sleep.
There's a common thought that some over-the-counter products such as melatonin are, the be-all end-all to any person troubled with this disorder. Is there any merit to that?
There is. First of all, we can get into this. Alcohol is really bad. So one of the things people will say is, you know what? I have problems with insomnia. Let's try alcohol. Alcohol causes sleep fragmentation. It may get you to go to sleep, but alcohol is a really bad choice. In terms of other over-the-counter products, of the group, melatonin is the safest. One of the problems with melatonin, though, is that we don't know what the right dose is. It's not a medication. It's just a brand, and you may be getting, if you buy something that says 1 milligram of melatonin, you may not be getting 1 milligram. You may be getting less. You may be getting more. In general, you don't want to take any more than 10 milligrams, but it is a naturally recurring hormone, so it's not in general dangerous. But if you take too much, it's going to be a problem. And there was a recent report about kids taking too much and opening up the bottle. So you really need to protect it from younger people. The Benadryl type agents, and most of them are like Tylenol PM, anything with PM in it. There's really very little data to know if any of those products are any good. They have a long half-life. So if you take Benadryl, you may sleep well into the next morning. They have anticholinergic effects, so not good with men who have large prostates. So we don't really recommend the Benadryl agents very much, and I don't think anybody should really be taking a Benadryl-like medication unless they have an allergy or skin rash or some other reason why they're taking Benadryl. But I'd be cautious all the PMs. And of the over-the-counters, melatonin is the best, but again, very little data to support its use.
Good to know. Now, let's get into some of the differences in age for a minute here. I've heard insomnia is just a normal part of aging. As you get older, you're probably going to experience insomnia. Is that true? Is that the reality?
No, I don't think that's true. I do think that menopause in women causes a lot of sleep fragmentation, hot flashes. So it is not uncommon for women going through their menopause to have problems with insomnia. But I see plenty of patients who are 30 years old who have insomnia. It's probably more genetic than anything else. As you get older, your sleep will be reduced. You often lose what we call delta sleep. So you often get less sleep. But insomnia doesn't have to be a part of aging.
I assume most people are aware that exercise is an important part of getting a healthy night's sleep. It's an important part of a healthy life. But how does diet affect our ability to sleep, either positively or negatively?
Well, first, I want to say that exercise is really good for insomnia because, first of all, it relaxes you, calms down some of the anxiety. It will make you sleepier. So exercise is a great idea. In terms of diet, eating close to bedtime is a bad idea. Probably a lot of carbohydrates close to bedtime, a bad idea. And there's thought to be certain foods that make you sleepy. That's why Thanksgiving, the turkey or the tryptophan maybe would help. But there's, again, no real good studies on these different dietary manipulations for insomnia.
Now, many self diagnosed insomniacs may say how their body has adjusted to the lack of sleep or poor quality of their sleep. Is the human body actually capable of adjusting itself to fewer hours of sleep over a long term period?
Not really. I mean, if you start doing it, you're going to get sleep deprived. I mean, there's plenty of studies out there that if you reduce your sleep to 4 hours a night over time, you're going to be sleep deprived and you're not going to function as well from a mental standpoint, physical standpoint. So I don't think your body can adjust. Now there's a sleep debt and you can recover that sleep debt. That's sort of what we do on the weekends, right? We recover our sleep on the weekends. And that's common because again, as I described earlier, most of our entire society is sleep deprived. The other thing that I would say, not so much that it's related to your body, but patients who have insomnia, people with insomnia, typically focus on your insomnia. The more you focus on it, the worse it becomes. It's kind of like breathing. If you focus on your breathing becomes really weird. It's like, I don't even know how to breathe anymore. So the more you focus on insomnia, the worse it becomes. It's very hard not to do that. But I try to tell all my patients, listen, try not to focus on this. The more you focus on it, the worse it's going to become. Don't worry about your insomnia. It's going to get better.
Now, I think we can probably guess that one of the effects of insomnia is you're tired. But what are some of the other effects of insomnia on our health, either short or long term?
So first of all, in terms of the tired piece, a lot of that's mental. And you think you're tired, but maybe you're not really so tired. You can probably do all the things you want to do. And in fact, maybe it just takes you a little longer because you're not quite as quick mentally, but you can pretty much do all the things you're supposed to do as long as you don't let it affect you. And that's one of the reasons why we actually think coffee is not a bad idea for someone who has insomnia to take. You don't want to take coffee close to bedtime because it will disturb your sleep, and obviously probably don't want to have any coffee after lunchtime. But in the morning, it's probably a good idea. But to answer your question, insomnia, at least associated with sleep, with short sleepers, has been associated with heart disease, so heart attacks, high blood pressure, heart failure. So there is some cardiovascular risk. These are in epidemiologic studies. These aren't typically one person type. You're absolutely going to get that. But if you look over big populations, short sleep with insomnia is a cardiovascular risk factor.
Now, what are some best practices our listeners can, implement to prevent insomnia? Let's say it's not totally a chronic problem at this point. Maybe it's been a week or a few nights. What are some practices that they can do to prevent insomnia?
So as I kind of described, exercise is really good. And it's not necessarily more cardiovascular exercise, not so much core training or weight training, but cardiovascular exercise. Obviously not drinking alcohol, because alcohol will cause sleep fragmentation and make things worse. And then going to bed at the same time each night. So one of the things that you don't want to do, and it's very hard if you're a shift worker and that becomes even more difficult, but if you're not a shift worker, is to go to bed at the same time, get up at the same time. Maybe on the weekends you sleep a little bit longer, maybe an hour, but you don't oversleep. So the more your body absolutely gets used to going to bed at the same time, getting up at the same time.
Couple. How much should we avoid our phones? Is there a time before bed we should avoid our phones? I think we've all heard about the importance of avoiding them as we get closer to bedtime.
Absolutely. So the bed should be used for sleeping. It shouldn't be used for working. It shouldn't be used for looking at your phone, paying the bills, watching television, any of that. In terms of the phone, yes, it will, a potential, especially blue light, it affects you, makes you less likely to be able to fall asleep. You do not want to use your phone within an hour or two of bedtime if possible, and absolutely not within the bed. And the bed needs to be used for sleep, nothing else.
Now, let's say we've had a bit of a chronic problem or an ongoing problem with sleeplessness. When should someone consult a doctor like yourself or someone else when they feel it's become a problem? Or how should they know that it is a problem?
Yeah, that's a really good question. And there's probably not a great answer for that. But I think if you start having consistent problems, and especially if there's family members who've had the same problem, because it may be genetic or something's changed. Typically, insomnia can happen after a terrible event, right? Somebody dies, and then it gets better. But if it doesn't get better over 3 months, I would think about being evaluated in a sleep center, because one of the things that sleep centers can provide, independent of medications, is something called cognitive behavioral therapy. And that's counseling. It does a lot of different things. It teaches you sleep hygiene techniques. It tells you what to do if you can't fall asleep in bed. It teaches you what to do, teaches you how to think about insomnia in terms of it's not overly manifesting in ways that what you might think are terrible but really aren't. And then what they do more than anything else is they make your sleep more efficient. They actually reduce your amount of sleep and then slowly increase it. So cognitive behavioral therapy is the best treatment for insomnia if you have chronic insomnia. Much better than medications, or at least as good as medications, and no downside, no side effects. And so if you really do have a persistent problem with insomnia, over, again, about a 3-month period, I would see someone in the sleep center.
Yeah. Yeah, my next question was about, quote unquote sleeping pills and whether they are a safe remedy or not. What is your perception there?
Yeah, the sleeping pills are interesting. They're all been designed for short-term use, so 6 weeks. But my experience is once you get put on a sleeping pill, you don't get they are not stopped. You are on them for a long time, and they have real risks. They have effects on your memory, especially as you're getting older. There's fall risks, so you get up to go to the bathroom in the middle of the night, and you've got a sleeping pill on board, and you trip on the carpet, and you hit your head, or you break your hip. I mean, you can die from these things. So we don't love to give out sleeping pills. Sometimes it's necessary, but they aren't really. They're not better than cognitive behavioral therapy. That's clear. There's real side effects. We don't really know what's the best medication. There's very few head-to-head trials. There's some expense to this. So in general, we like to do cognitive behavioral therapy. That being said, you can't get that for everybody. And again, a lot of people will try over-the-counter melatonin, I think is fine. And you can try different sleeping pills, but that wouldn't be my first treatment.
Are there any other myths regarding insomnia that you want to clear up for our listeners, or questions that you've gotten from patients or even from students that you want to clarify here?
Sure. So again, just reiterate the fact that alcohol is a really bad choice. And then cannabis, or the cannabis-like products. Um, so it's not clear they help insomnia. They're very good for people with chronic pain. And I think they help people sleep who have chronic pain. But the one thing about cannabis in any of its forms, if you take it regularly, the one data point that I think is relevant is that when you stop it, you come off it, you are going to have very bad insomnia. So if you start a cannabis-like agent and you have insomnia and you come off it, that's going to be a problem, because that's the one feature of cannabis that's been shown over and over again. You stop it, you're going to get sleep, you're going to have problems with insomnia. So I'd be very cautious before I started anything like that. On the other hand, if you have chronic pain, I think cannabis and the products are good for people with insomnia, with chronic pain.
Dr. Schwab, thank you so much for your time. For now, let's stop there. And on the next episode of the Merck Manual's Medical Myths podcast, we can focus on the topic of sleep apnea. For our listeners looking for more information about insomnia, please head over to merckmanuals.com. As we close out, I'll let Dr. Schwab leave our listeners with the final word.
Medical knowledge is power. Pass it on.